Blake Benson with Pittsburgh Area Chamber, joined off camera by Julie Reams and Josh Lowe, here for an important business conversation with Dr. Linda Bean, Dr. Tim Stebbins, our Crawford County health officers. And first, before we get to Dr. Bean and Dr. Stebbins, I just wanted to publicly thank them on behalf of the Chamber for their leadership, for their efforts, also that of the Crawford County Commissioners. Thank you for all you've done to work with our business community. I know that I have sent several businesses to Dr. Bean and Dr. Stebbins for help in crafting remediation plans and that helped businesses through the COVID timeframe, or still helping businesses through the COVID timeframe. But we really appreciate your efforts, your leadership on behalf of the business community, and thank you for reaching out to us for this opportunity. They asked for this, for the opportunity to visit with the business community to share some very important information that will help keep our economy open, particularly headed into the holiday retail season. We know how important this is for so many of you out there. So I would ask that the business owners that are listening, I would encourage you to take this information because it's intended to be helpful. It's intended to keep our local businesses open and our economy humming. So thank you again for your time, Dr. Bean and Dr. Stebbins. We will ask for you to share some information with the business community. And then several of you have asked specific questions to Dr. Bean and Dr. Stebbins, and we'll get to as many of those as time will allow. So I'm not sure who gets to go first, but if you will, maybe bring us up to speed and share anything you'd like to with the business community.
Sure. And I would like to say thanks to Blake and his whole team at the Chamber. We have really had a great opportunity over the last 6 months to work with a lot of the businesses, and we so appreciate how hard many businesses in our community have worked to help us keep our community safe and work with us. And so, you know, we do have had a number of questions. So much has changed over the course of this year, and as we head into winter and the holiday season and all of that with retail, a lot of questions have come up. And we think this forum works very well for us to be able to communicate and answer questions. And so thank you for having us.
You're quite welcome. Thank you.
And I'd echo those comments too with respect to thanks for the Pittsburgh Area Chamber of Commerce for hosting and helping us get this information out. We as health officers are here to help the public remain safe through these times of COVID. And it's difficult, right? We'll get into the historical perspective, but just understand that this disease and pandemic is 10 months old in our country. So we have 10 months of data. That's very little. So a lot has changed. And that actually in itself creates confusion. And so as we have gone along, we have learned things and we put those in place. Some of those are changes from previous, which causes confusion. It creates some mistrust in the medical community and our leadership community at large. Understand, we're not changing our minds based on any of that. We're changing our minds based on current data, current science, and common sense. Those are the three pillars that we use for every decision that we make. So that what we're doing is appropriate for where we're putting that decision in place. And so a little bit of the historical data. Crawford County experienced our first outbreak in June, right before we took over. That involved nearly 200 cases. Currently in Crawford County, we have 1,605 cases since inception of the disease. We didn't see a significant rise in COVID-19 cases until August, and that was when the college students came back. And one of the concerns that Dr. Bean and I have are the mixing of cohorts. And I think that's always been a fear of ours. As we bring cohorts in or change cohorts, there's definitely a chance for spreading COVID-19.
And cohorts are typically a group of people that are together all the time. And so if there's like a family is
right.
A cohort, a group of friends that spend a lot of time together, you can have work cohorts, so people that work together.
Student cohorts.
Student cohorts. And so as, typically if you stay within a certain group, there's less chances that transmission of COVID can happen. But especially as those groups become larger and there's more mixing of that, then there's more chance of spreading.
And once it spreads into your cohort, it spreads through your cohort, and that's the concern. What we found as the college students came back is we had a sharp uptick in cases in our community, and spread largely through some of our businesses as they mixed there, which was a concern. And through that we then initiated our first health order, which was actually our second health order, and that was the work with the local businesses for the appropriate mitigation strategies to help prevent COVID-19. Through that, we had about 500 to 600 cases associated with the college. Now, we work very closely with the college and the college leadership, the college health, in an effort to mitigate that. And I think we were quite successful after we put those in place and through their work and our work. We follow the data very closely, and just so you understand where we're at right now, currently we have 87 new cases this week, and our case count is from Sunday through Saturday. So we do that every week. This week, currently we have 87 new cases. Last week we ended with 108. We suspect this week we will fall in line with that 108, I believe, at 100 or so. We'll see what today, tomorrow, and Saturday brings us. We have averaged 80 to 100, well, it was actually 77 to 108 cases over the last 6 weeks. That's concerning for us, right? What's that?
Per week.
Per week, yeah, 77 to 108 per week over the last 7 weeks. That's concerning for us because despite all of the mitigation that we have in place, we're at a steady state, meaning the number of cases, if we put no more changes into the system, the number of the cases are going to stay the same, we would expect. And that creates opportunity for harm in our community.
And we were at a steady state after our initial outbreak in June. We were at a steady state, but the numbers at that time were about 20 or less per week of positive cases. So we continued to have some COVID in the community after it was introduced into our community, but at a very low rate.
Right.
And then when the students returned to school, like many of the college towns, those numbers went up significantly. And like you said, we are now at a much higher steady state. So initially after that, we had 200-300 positive cases at one time, and now we are back down to between 80, 90, 100 per week, which is still in that red zone that we talk about, and we'll talk a little bit about our gating criteria and how we look at that. But I think the most significant thing that came out of that second wave that we experienced was that it moved from one cohort, which was business related, to the community and what we call community spread.
Right. Before we had a group that it was transmitting within and out of. And once we got a handle of that group, we were able to slow that down significantly. The problem now, what we consider, and more importantly and more concerning, is community spread, meaning it's not in a specific cohort, it's within the community. Right. And breaking that chain is a little bit more difficult.
Right.
We have currently 177 active cases in isolation, almost 900 persons in quarantine related to those infections. One of the things, and so I'll back up a little bit, just so we have a little bit more historical perspective. Kansas currently has, we've seen 92,000 cases within the state. Of those, 3,984 were hospitalized. Of those, 1,087 have died. And so that's important data for us to use in our area, in that it gives us the hospitalization rate and the death rate, which the hospitalization rate a little over 4%, the death rate a little over 1%, meaning 1 out of 100 people that contact COVID-19 will die. 4 out of 100, up to 5 out of 100 will be hospitalized. We're running about 100 cases per week. That means if we use that data, we would suspect 1 of those every week will go on to die in our community. That's our friends, our family, our neighbors, people that we know. And we're seeing that. We have 14 deaths associated in Crawford County currently. We're at 1,600 cases now, 200 new cases, so 14 deaths of the 1,400 cases, that's
right.
about right. In our hospitals, I will tell you, Ascension Via Christi and Girard Medical Center and Pittsburgh State University, the Bryant Student Health Center, as well as the rest of the medical community, or clinics, community health, the nursing homes, long-term care facilities. The medical community has banded together in an effort to fight this, and they're all doing an excellent job. And I'll tell you, without their help, support, and hard work, things would be much worse here. We've seen them grow together in strength and unity and purpose to fight this with great results, to the point that we are helping not only Crawford County, but Bourbon County, Cherokee County. We're crossing over into Barton County and Vernon County in Missouri to be a place where we can care for those that are ill with COVID-19, and even farther, quite frankly. And so they've done a great job. Now, in the hospital, we have had some challenges in that we've seen a lot of cases that have been here for a long time. We've seen deaths, we've seen capacity challenges to the point that the hospital actually changed what they did in an effort to handle that by slowing or stopping elective surgeries, to realign staff to care for those that are sick, which is amazing in that they stepped up to the plate to care for those in need. And we've had up to 25 cases of COVID in our hospital. Today, currently, we have 10. That's great news. Well, that's not the end of the story. We have 200 more cases recently that are in line. We have 300 more cases recently that are in line. And that's just Crawford County. Remember, our catchment area is much larger than that. And so that's a concern. And that's why we are working so hard to do whatever we can to break the chain of transmission through our collaboration in the community with all the medical entities. The leadership in our cities and county are doing an excellent job and being very supportive. And we're working with them, and they're working with us, quite frankly, right, to help reduce injury, illness, and death in our community.
Right. And I think that it's important for everyone to understand that as the health officers, one of the big focuses that we have had as we've been managing this pandemic for our community is our concern about the impact on the hospital. And the number of cases, because a lot of, question is, how is this different than the flu? And worrying about what those numbers mean. And ultimately, because of the impact in the hospitals, not just our hospital, but all of the hospitals that are around us and throughout the state, is that when a hospital system becomes overloaded, we can't care for the other things that we need to care for. And so one of the big reasons for managing the number of cases and not just let it go like wildfire is because we have to be able to continue to function in our hospital capacity.
Right.
And we did see that following our significant increase in the community, it goes from maybe a less vulnerable population that's less vulnerable to severe illness with COVID, making its way into the vulnerable population, whether that's long-term care facilities, whether it is just someone at church that is older with medical comorbidities. And we did see a significant uptick to the point that we had to change things in the hospital
Right.
to be able to meet that capacity and still meet the capacity of other illnesses that are still going on.
Yeah, we still have heart attack, we still have stroke, we still have diabetes, we still have high blood pressure, we still have trauma, and all of these things we need to take care of as well, and they're still coming.
Right.
And we have to take care of the significant uptick of COVID, and, oh, by the way, flu season's coming.
But what we have seen so far is because we have been as a community very engaged in having mitigation strategies, wearing masks and doing hand washing and social distancing and businesses doing these things, we are able to return to a steady state. The hospital is able to return to a manageable capacity, and we can manage it.
Right.
Whereas other communities that maybe are not as engaged in that are still maxed out and not accepting transfers
Or transferring to us.
or transferring to us. So that's one of the reasons we feel like what we've been doing so far has been working, because despite these increases and despite everything that is bound to happen, vulnerable people getting it, we have been able to kind of return to a steady state that then allows us to manage it from a hospital standpoint.
Right. Now, we are asking the community to do a few things, though. And this comes from not only our data, and we can talk about our K through 12 data here shortly, which is enlightening as far as mitigation strategies, because they've done an excellent job and it's effective. But this falls back too with where we've got some of this information. Now, the data suggests if we do a few things, we can break the chain of transmission. Mask, social distancing, hand washing, making smart decisions. But it also comes in the form of orders as well. The governor's order 2052 mandates masks in the communities. That is still in place. That is re-upped monthly, and I suspect that will continue to be re-upped. We also have Health Order number 3 that specifically addresses businesses and communities, highlighting the bars and restaurants because of food service and the risk of transmission there. And that those mandate masks. They mandate the social distancing within the businesses. We're following those orders. That was upheld by our county commissioners appropriately. And the difference in our community and other communities surrounding us as far as number of cases and deaths is directly related to that. Now, how can we say that this works? I guess would be one of the questions we get. How do we know that this works? So why does the mask work? How is that effective? And I'm asking.
Oh.
I'm gonna give you the opportunity, and we can talk through that.
Well, there's a couple of different things. From our standpoint, probably the biggest reason for wearing a mask is what we call source control. So the way this virus works is you are more contagious in the 2 days before you start developing symptoms, which symptoms may be mild.
Right.
You may think you have allergies, you may think you have a sinus infection, but those 2 days before you even develop any symptoms or have only mild symptoms is when you're most contagious. Before you have a fever, and some people never get fevers. And you can be spreading it and sharing it with everyone that you're around, including your coworkers, your customers, your family, your friends,
businesses that
your
you're going
friends,
into.
and all of those. And so we know that wearing a mask, especially during that time and any time that you're contagious, is helping to prevent those large droplets from when we talk, we cough, we sneeze, all of those things from going out and getting other people infected or contaminating surfaces. So it's what we call source control. So the biggest reason for wearing a mask is not necessarily to keep you from getting it, keep me from getting it from you, but if I am not yet knowing that I have it and I'm sick, not spreading it to you.
Right. And so that's one important point that there's confusion related to about the mask. People are saying, I don't want to wear a mask, I don't care if I get it. But what we need you to understand, it's not about you, it's about you spreading it to somebody else. And that may be somebody quite vulnerable, right? That may be your family member, especially with heart disease, diabetes, high blood pressure, obesity, highly likely to have more significant and or deadly disease. And while many times this is a mild disease, we see in all age groups long-term effects related to COVID. Cardiomyopathy is one of the big ones, where we have student athletes that are no longer able to play. Their careers are over because they got COVID, and now their heart is double the size, and they're essentially in heart failure at 20, right? Devastating impacts. And we don't know how long that will last because, well, this is only 10 months old. But it will, it is career ending for them at that point. And so we need everybody to understand the mask isn't about you personally, it's about everybody that you're around. And while there is some protection for yourself in a mask, the more important point is you're protecting others from you in case you don't know that you're ill yet. And with community spread, there are a lot of people out there, they don't know that they're ill yet, and they're spreading this. And for the business aspect, understand when you ask your customers to wear the mask, and you and your businesses are wearing masks, you're protecting your business. And we've seen businesses, several in the community, that have had to shut down, not because we shut them down, but because they didn't have the employees to run their store. And that's 2 weeks out of, with isolation and quarantine, that's 2 weeks of closure. And in the Christmas season, that could be devastating for a business when they're getting half or more of their income in these next 8 weeks. It's highly important that you protect yourselves and your business from COVID-19. And it's as simple as a face mask.
And I think that's the second big important piece that we as health officers need to relay is, our first look at this is looking at the hospital capacity and our ability to take care of the health of our community. But the second piece of this is that it really is important for us for economic security of our community and for our businesses to be able to stay open and be able to function, and
Right.
and we need that for our community as well. And if all of the employees get sick because of someone coming in, businesses have had to close for 2 weeks in order to be able to accommodate that.
Right. And we have always been advocates for keeping things open.
Yes.
And an example of that is the school systems. We, from the beginning, knew that it was important that kids were able to go to school, be in school, remain in school. But we needed to do that safely. And so we worked with every school system in the county to establish an appropriate mitigation plan based on the Board of Education, KDHE guidance, and the data we had locally, and put that in place. Through that, we have been very successful. Now, we currently have 21 total cases out of the 6,000 students and another 1,000 to 1,500 staff through the community. There are 196 quarantines. Most of those are modified quarantines in the elementary school. But we found with that data, and we track that data at our health department with our own epi nurses, we found that with the mitigation in place, we're not getting in-school transmission, which is amazing, right? That's using masks, hand washing, social distancing, making smart decisions. And we've actually been able to change our standards a little bit there using that data. What we're trying to do is get the community to follow the same rules because we know it's effective. Now, we have 21 in school right now or associated with the school that have COVID-19. None of them got it in school. All of them got it in the community. And despite that, we still are not transmitting it within the school. A few exceptions, unmitigated times, break rooms, probably the most dangerous place in your organization, right? Everybody takes off their mask and they eat. And then unmitigated cohorts before or after you're involved in that. And that's where people take off their mask and they spread it between each other. And so the mitigation strategies work. We've proven it with 6,000 people. And that's what we're trying to, that's the information we're trying to get to the community at large.
And so can you clarify, you touched on it, but I just want to make very clear, can you clarify that the county's face mask mandate is in fact a law? It's not a recommendation, it's not a suggestion, it is expected by the county that everyone wear a face mask, businesses wear a face mask, employees. Where exactly do those requirements come in?
So the executive order, the governor's order, 2052, dictates that all businesses, you'll have masks on. Now, if you're in your own office, then that doesn't apply. If you're by yourself, right? But if you are front facing to the public, food service workers, preparing food, the governor's order dictates the mask must be worn. And in fact, it says in all public spaces, and indoors always, and outdoors in public spaces if you can't maintain 6 foot of distance. Now, private businesses, if you are in your office, you're by yourself, that's a different story. We're not asking you, that's silly, and we're going to use common sense, right? But the front-facing ones, yes. And that's backed up with the health order number 3, specifically for restaurants and bars, as we know that there is risk, especially in that area, of transmission as this goes from, it goes from the person that's sick to the person that it's getting infected through the mucous membranes. Well, if you're preparing food, you have droplets coming out. You're putting it directly on your mucous membranes. And so we have to be vigilant on that. And yes, it is in place in order for both of those. Okay,
thank you. And some did not catch the question, and you were just clarifying that it is law that you have to wear a face mask unless you're maybe in your office by yourself, especially if you're public facing, you are expected to wear a mask.
Yes.
So thank you for clarifying that. Kind of part B to that question, several of the businesses that I've spoken to, many of whom are following the guidelines and are asking people to wear face masks. Sometimes they see other businesses that are not as strict about it. And I know they're a little frustrated, as you probably are as well, because sometimes they then lose business to businesses that aren't requiring face masks. So what would be the enforcement, the penalty? What can be done about those that are not following the mandate?
Yeah, and this is where we're going next. There are penalties in place in both the governor's order and in health order number 3 for businesses up to and including closure. What we want to do, though, is do that smartly in an effort to try to help businesses be successful everywhere. And we're working with the county commissioners and county attorney now to, instead of going directly to closure, we're going to go through an escalating system, initial being just the warning, and then we're proposing a fine, and then a second fine, and then closure, potentially through court injunction. We don't want to get there, right? Honestly, what we want to do is that all of our community work together to save our community. It's as simple as the face mask, right? There really should be no reason why we get to a fine or closure.
And we have found that we've had the opportunity to visit with businesses that there's been concerns about, and we have the conversation and help them work through meeting the requirements, and they do.
Right. And I think by and large, businesses want to be successful, and we want them to be successful. They just don't necessarily understand the mitigation or how it can work within their system. And we've actually gone into several businesses and helped them through the mitigation process so they can maximize their customer base, customer service, and minimize the impact on their business while still being safe and breaking the chain of transmission. Now, in restaurants, it's a little harder because you're closing down some table space sometimes. But we've had businesses that have used the plexiglass around the booths, and we're able to open up all of those. Can I say a name of a business? Is that gonna?
Would prefer you don't.
Or just a business that I know has done well.
Oh, that's doing well, absolutely.
Yes.
Yes, absolutely.
So, so everybody understands, we live here, we work here, our kids go to school here, we shop here, we eat here. We're a part of this community. I was at Applebee's last night, and they're doing a great job. They've every other booth, they've got every other table across from the booth set up. All their servers were wearing masks. As a health officer, knowing the challenges and how devastating this disease can be, I'm comfortable eating there. And we've done it several times in the last couple months because they have the mitigation strategies in place, and I see them doing it. I feel safer. And I think all businesses maybe should hear that point, because there is a part of our population that is not going into places because they are afraid. And utilizing the mitigation, showing the public that you are trying to prevent the spread of COVID-19, that you're doing the right thing, that you're looking out for their well-being, they'll feel comfortable, they'll go into your business. And we encourage that. And we encourage customers to say both, hey, I feel comfortable here, which I did. I pulled the manager directly and said, thank you. But also I would say, you should also say if you're uncomfortable, right? It's hard. None of us want to be confrontational. But to say, we thank you for looking out for my safety. And that's a part of what we're doing as well. If we get names of businesses through the health department that are doing very well, we're gonna acknowledge that through a certificate of appreciation to say, you are doing this well, and we appreciate what you're doing for the safety and health of our community. Go on.
Oh, well, I was just going to say, I think that one of the big questions, and maybe what businesses are wanting to know what our ask is of them, because the enforcement piece of this is a challenge. And, I think one of the main things that we want to say for the business owners is you're not going to be able to police everybody that comes into your business and make them wear a mask or kick them out or whatever. But what you can focus on isn't on you and your staff, first of all.
Right.
And sometimes it's just asking. We would ask that you please wear a mask, and most people probably will. So it doesn't have to be a big, call the cops or kick them out or anything like that. Sometimes it is just simply asking, saying, we would like our patrons to wear a mask, and most people will.
The signage at the front door saying mask required, that's helpful. The community has set up its own task force Crawford County United to make the pledge and have signage related to using the mitigation strategies that we've outlined, and pledging that they're going to do those within their businesses. And I encourage you to do that, to show the public that you're doing your part to break the chain of transmission, and that you are looking out for and care for the safety and well-being of our community, right? And I think that will help, right? The question about the businesses, losing businesses to businesses that are not, that's where our next piece comes in.
Correct. Because we recognize that, and that is...
And we're going to have to do something about that. We know that. Because it's harming our community.
Well, and one other quick point I'll make to businesses that maybe are not enforcing this. I know there's also been a frustration from some business owners that they feel like they've gone to great lengths, often great expense, to protect their employees while they are at work. They are following all the steps because they want to protect those employees. And then sometimes they see on Facebook or they see their employees out in the community at a business not wearing face mask, and they're a little frustrated that what they are doing in their business is all for naught because it's not being commonly practiced across the community.
Yeah, and we agree with that, and that's why we added the smart choices to the mitigation plan, right? The mask, social distancing, hand washing, that's all there, that's all in policy. But smart choices, people have to make a choice, right? And while you may not see the impact of your choice right away, you get your mother or father or grandmother or grandfather or somebody in your church or other part of your community ill because of your poor choice and they die, you're going to feel pretty bad about that. So we need people to make smart choices. We need the employees to make smart choices. We need the public to make smart choices. It's harder at this time of year too, because we want to mix for holidays.
Sure.
And they can also feel good though about for the businesses that have put the time and effort into those safety practices. If they have an employee that goes and is exposed in another arena, knowing that when they come to work, they have to wear a mask, they have to distance, they have to do these things, they are continuing. If that employee is pre-symptomatic, those measures are going to help prevent them from spreading it to their customers and their other employees.
Certainly.
Those type of things will help us in making decisions on who to quarantine, how that's going to impact the business itself. And so that's another great reason for the businesses to ensure that their employees are wearing the mask, is to protect their business from that type of behavior.
Because we do work with individual businesses all of the time about quarantining and
how we can successfully
keep them open and staffed. And it's much easier for us to be able to work with them if they are doing those things.
Sure. Well, there's obviously been a lot of great information about COVID. Sometimes it can be a little overwhelming, especially for those of us that are not in the medical community. I think the county, and with the addition of Samantha Garrett, she's doing an incredible job of keeping the numbers updated on the county website. We had a specific question from a business owner about the hospital capacity number. So the only visual aid that we brought is kind of a blown up graphic, and would ask one of you to maybe help us understand exactly what the hospital capacity numbers are. Thank you, Julie.
Oh, that's nice.
So I will just I'm not sure which one wants to handle it, but tell us what we're looking at.
Well, so the Crawford County gating criteria, we actually adapted this from the school reopening plan, right. And kind of adapted it to meet what we were already looking at data-wise as specific to Crawford County with the health officer role. And so, but one part of that is looking at the hospital capacity for the reasons that we talked about before, because as numbers increase and as vulnerable people become infected, and the impact that that has on the hospital. And so that has been a part of our gating criteria that kind of tells what the overall impact, what the overall impact in our community. And that's what we, from the beginning, we only wanted to make decisions based on what the impact is on our community. Whether the virus is here or not doesn't matter unless it's impacting our community. And decisions that were made back in March and how, based on what we knew at the time, wasn't necessarily as useful because we didn't have the virus here. And so when we took over in June, it was very important for us to look at the data specific to us in our community, and not only just numbers, but how is that impacting? And so that's where the gating criteria came from, because it looks at all these numbers, but then we also put it together as far as what is that doing? Is it negatively impacting our community? Is it not negatively? And for a long time it wasn't. We were in the green, we were low impact, our hospitals were fine, our case numbers were all manageable. And then with the changes, we've changed our colors.
And just so you know, this is half of our gating criteria. We have the community gate, and then we have the school gate. The school gate is actually all green. I think the specific question was capacity, and this does get somewhat confusing even for our hospitals.
Right.
The capacity is the capacity remaining. How much is left that we can utilize in the hospital? So for last week, we had med-surg capacity greater than 30%, which was awesome. But our ICU capacity in the region was only 15%. And we've actually been down to less than that, and for briefly, zero.
Right. And it can change from day to day in the hospital.
And it does, but and we actually look at that day to day. Every day we look at this to kind of determine where we're at in the community. But less than 15%, and really it's less than 10% remaining capacity, actually moves us up into a different category. We have been floating the 0 to 20% pretty much for weeks now.
And that's looking at bed capacity as well as staffing capacity.
Right.
Because if our healthcare staff is going out and getting infected and unable to work, that changes what we can do in the hospital. So it's looking at a combination of how many beds are full and how many staff do we have to take care of them.
There obviously is a big fear of a potential business shutdown or a community lockdown, whatever you would call it. So we did have some specific questions related to what kind of indicators would trigger something like that. Can you tell us, as you advise the county commissioners, what kind of data are you tracking that could make that a possible scenario?
Yeah, I will tell you to start with, overall, we are not fans of lockdown, community lockdown. We weren't a fan of the initial lockdown, and we haven't advocated for that at any point in our career as a part of this. To lock down or shut down a community, it would have to be bad, both in our hospital capacity, the spread, and the total numbers within the community. Now, does that mean that we wouldn't try to work towards areas that we see outbreaks and impacts, not the right word, but make changes in certain areas if we saw high risk areas or high transmission rates or high outbreak rates? Yes. Obviously, as health officers, we have the responsibility to react if we see that. Right now, we're seeing community spread at a number that is not overwhelming but concerning.
And that is where our health order number 3 came from, because we did have concerns about specific businesses contributing to the significant spread that we were seeing in the community. And so rather than just locking down and shutting down all businesses. We tried to target it to the areas of concern.
Yeah, and actually, even when we looked at that, so businesses understand what we do and how we think about this. That was preceded by health order number 2, which was more restrictive. We had that health order in place for 1 week and realized that the restriction for closing time, we didn't think had a positive impact or would have a positive impact on reducing the number of cases. But it did have an impact on businesses. And in looking at that, we thought, that doesn't make sense. Doesn't pass the common sense test. And the current data didn't show that it was going to be effective. So we removed that as quick as we could, right? As soon as we realized that wasn't going to be effective, we got rid of it. And we look at all of this in that same vein, in that same light. We want to have things in place that are effective, that can break the transmission, and we don't want to negatively impact any person or business with something that we don't think is going to be effective, right? And we look at this week to week, well, day to day, week to week, month to month, as we go forward. Right now, what we're asking for, we think is going to be here for a little while, and it should be, but we will continue to look at that.
Dr. Bean touched on quarantining a little bit earlier, and there's been a lot of information about when to quarantine, so much so, and universally, not just locally. Can you clarify when exactly a business should ask an employee to quarantine? Is it if they have a family member that is quarantining at home, should the employee also be quarantining? Does it require just close contact?
I think the main thing is that they work with the health department about quarantine, not only who should be quarantined, but also timeline and how long and all of that. So, first off, the main thing for the businesses is anybody that is ill. So part of the mitigation strategy is to identify employees that are ill before they come in and potentially expose everybody in the business. And so, whether it's, just making sure that people are, if you have concerns, you hear them coughing and talking to them about going home if they're ill, staying home if they're ill, and allowing for that. And certainly anybody that has a confirmed positive COVID test should be isolated, not coming to work, not out and about. We call it isolation. It's the quarantining of a sick person,
right,
which is isolation. And that again should be done in conjunction with the health department, because the health department or the state health,
that may be the state,
yes,
KDHE,
will determine when they are allowed to return to work or school or wherever. As far as quarantining of contacts, that again is working with either the local health department or the state health department on determining who is considered a close contact. So a close contact is someone, according to KDHE regulations, is if you've been within 6 feet for more than 10 minutes. And so it is good if a person contracts COVID to be thinking about who those people could be and letting them know, because that's the quarantine is when we break the chain and where we can prevent that transmission from going beyond. And that's why that's an important part of this. And so that's not, I know somebody who has it, I need to quarantine, or I passed them in the hallway, I need to quarantine.
Yeah, and contacts of contacts. So if you know somebody that was quarantined and you've been around that person, that doesn't mean you have to quarantine.
Correct.
You only have to quarantine if you were in contact with the sick person, not the contact of the sick person. And so I think that was one of the questions. Do contacts of contacts have to quarantine? No, we don't want to do that. But if you were in direct contact with the sick person, yes. Now, it is 6 feet for 10 minutes, or if you're unmitigated and they're coughing and sneezing at you, that would put you in a quarantine scenario as well, which is another reason to wear the mask, right? And that'll help prevent the spread from the person and for you contacting it.
Well, I know we're I know we're getting close to 1 o'clock. Certainly want to respect your time and everybody that has joined us. Any closing comments, any parting information that you want to make sure that the business owners that are watching and listening today, that they walk away with?
We are trying to provide appropriate mitigation strategies and ideas to the businesses and public, really for our community, right? We're not here to take away a person's right. We're not here to impact a business negatively. We're not here to make things hard on anybody. We're here to get the word out, to tell people what can help them. Remember, we all live and work in this community. We are all part of this community. The people that are impacted are our friends, our family, our neighbors, our kids, our businesses. And so we ask you, please, just embrace these ideas, embrace these, I don't want to say regulations, but embrace the mitigation strategies that we're recommending, and we can together break that chain, right? And that's ultimately what we're trying to do, break the chain of transmission so we can get out of this. You know, a lot of people are mad at COVID and they take it out on each other. Don't be mad at each other, be mad at COVID. COVID's the bad person here. And work together to get through this, right? And I think if we all embrace that, we can get through this with the least amount of impact on all of us.
Anything to add, Dr. Bean?
I think you did a good job of summing it up. I mean, and just to remember, again, you know, we appreciate the businesses that have reached out to us already, and we are more than willing to work through specifics, because every case can be different, and that's what makes this challenging, is you can't just have a black and white answer for anything. So, you know, we are here to be available and to help businesses that are trying to do the right thing and make it as easy on them as possible.
Well, thank you again for your leadership, for your expertise in leading our county through this. I also want to say, you know, thank you to the business owners. We know that this hasn't been easy for you by any means, because not only do you have the same health concerns that the rest of us do for you and your family, you're also worried about your employees, and trying to make sure the business is successful as well. So we know you have a lot on your plate. I would encourage you, if you have questions for Dr. Bean, Dr. Stebbins, and the County Health Department, please reach out. They've been very responsive and very helpful. They are here to help you, and we want you to stay open. So please take the advice, the information that you've been given today, put it into practice, and let's make it a great holiday season here in Crawford County. With that, thank you for watching, and we'll bid you a good day.